Okay everyone, so we've got Amber here. He's in for a surgical procedure today. So we need to take our pre-op bloods we're checking sort of his general health. We're going to be looking at his liver enzymes and his kidney enzymes, as well as his red blood cell levels. So we're looking to see if he's anemic and his protein levels as well. So what we need to do, I'll show you here, we've got to clip the area and prep the area. So we use an F10 antiseptic wipe there on some little cotton balls, and we also use surgical spirit afterwards, and I'll show you us doing that in a moment. We've got various types of blood tubes. What we need today is this orange one, which is a lithium heparin anticoagulant. So that's specific for the blood test that we're doing today. We do have other types, so we've got EDTA anticoagulant and also plain tubes for serum samples. So today we're just taking the lithium heparin, and we're also going to collect some samples in these tiny little glass tubes. And for that we spin down and we're checking the PCB. Okay, so when we take the blood sample, we're taking it from the jugular vein, which is situated here on the neck. So raise the vein to get the general feeling of where it is, and I can see it raising just there nicely. So I'm going to, if Amber's going to cooperate, good boy. Good boy, Amber. It's okay. Sometimes they just need a bit of reassuring. It doesn't hurt, but they're just obviously a bit nervous because they're not sure what's happening. So we just clip the area a little bit, just so that we can visualise the vein a bit easier. And it makes the procedure more aseptic. Okay, so I've clipped the vein there. There's a little hairless patch there now, and you can see the vein raising really nicely. I'm going to take my swabs for cleaning. So I've got the F10 antiseptic swabs. Good boy, it's okay. It's okay. Good boy. Just talking to them while we're restraining them helps to reassure them, make sure there's no panic, because they just don't know what's happening. We can't explain to them that we're not going to hurt them. So now using my needle and my syringe. Good boy, Amber. There we go. So you can see he barely reacted there, so it doesn't hurt at all. They've just got a little bit of fear because they're not sure what's happening. But we reassured him, he's comfortable, he's happy. So we can take that muzzle off him now. There we go. Good boy. Right. So now we have to get the blood sample. So we take the needle off and we fill up to the line of the tube. And we make sure that we invert the tube 4 to 5 times, just so that we thoroughly mix the blood in with the anticoagulant and the blood doesn't clot. I also just need to fill up the glass tubes. So we just literally pop the glass tube into the blood, and it just wicks all the way up the tube there and fills it completely. And that's it, we're done. So we can run those blood tests now.